Dr. Vince, could you share the latest advancements in bladder cancer treatment? And are there any emerging developments that have the potential to significantly change the standard of care?
Yeah, typically what we think of when we talk about bladder cancer treatments is we divide bladder cancer into what we call muscle invasive or non-muscle invasive. And so when it comes to the treatments, we base those treatments based off of what category you may fall in. But in recent years, there have been a number of advancements for bladder cancer treatment. Um, One of the notable developments is the use of what we call immunotherapies. These are typically in patients who have muscle invasive bladder cancer, but it provides a alternative to the chemotherapy regimens that we relied on in the past, which a lot of patients did not tolerate. So these immunotherapies give us the ability to fight off the cancer while most patients are able to tolerate these medications with much more ease than they were with chemotherapy. The other thing that I think about is in the same realm as muscle invasive bladder cancer is now we have bladder preservation options, whereas before, when I was initially training, if someone had muscle invasive bladder cancer, that meant that they would either get what we call neoadjuvant chemotherapy, which just means before treatment, their main treatment, get chemotherapy before that, followed by bladder removal and some type of diversion of the urine. Whereas now we have the ability to give what we call chemoradiation, which is a combination of chemotherapy and radiation to the bladder, so that way patients don't have to lose their bladder. So we allow bladder preservation while still being able to give treatment that is curative in nature. So I think that has been two of the most recent advances when it comes down to shifting the paradigm on how we treat patients with bladder cancer.
Okay, thank you. And one follow-up to that. So when you talk about bladder preservation, is
Yeah.
that the standard of care now, or is that something that a patient would need to ask their oncologist about?
Yeah, so actually, a lot of cancer guidelines that are published nationally by, national institutions or national organizations like the NCCN, for instance, this is now in the guidelines where patients can have this therapy and it's recommended. Now, there are select patients who fall in the category that are eligible for chemoradiation, but this should be something that's discussed in addition to more invasive treatments like what we call a radical cystectomy, which is just removal of the bladder.
Okay, thank you. And do you happen to have an activation tip for this question?
Yes. So I'm a big believer in education, education, education. So for patients specifically, I like to say, again, know everything and please try to understand everything about your cancer diagnosis. So specifically when we talk about cancer stage, and this goes back to the muscle invasive versus non-muscle invasive bladder cancer, because the treatment options vary drastically depending on whether or not you have non-muscle invasive bladder cancer versus muscle invasive bladder cancer. So for those with non-muscle invasive bladder cancer, we typically do intravesical therapies, which means instilling medication in the bladder versus the more aggressive treatments that we do for people with muscle invasive bladder cancer. So know your stage and try to know everything you can about your diagnosis.